I am 68 years old, and I woke up one morning and I just didn't like the way I looked. I was shocked to see that I had what I call jowls, and this whole area of my face suddenly had no elasticity, and I looked at my neck, and it just was something that I had not seen before. It just made me look much older than I feel. And I don't feel that I look like what I image myself as. I think that I'm vain in a very positive way. And it is important to me to look the best I can. And I would like everybody to look at me and think I look terrific, but the most important thing is for me to look in the mirror and look and say, gee, you look good. I've seen a number of doctors. I didn't do anything because nothing just seemed to be comfortable for me and right. But I continued to pursue it. My major apprehension was not the procedure. I have been very concerned about finding the right physician. I've been very concerned about not wanting to look like my skin was pulled tight or that I was trying to look 40. I needed to know that this would be an enhancement. Dr. Steiger was referred to me, and I made an appointment, and I came up to see him. He spent an inordinate amount of time with me. He was patient. He answered all of my questions, of which I had many. We discussed very much at length my feeling of not wanting my face pulled up, not wanting to look like a deer in the headlights, as I called it. He explained everything to me. Coming here was absolutely comfortable and comforting. And this is why I feel the way I do. I spoke with Dr. Steiger, and we spoke at length, and I explained my feelings about what I wanted and what I did not want. I got very comfortable. I think that we're on the exact same wavelength. I will look better. I will look much more youthful, but still be the age I'm at. When I was finished speaking with Dr. Steiger, I was fully aware that I had come to the right place. Sometimes you're just lucky enough to find the right place and be in the right hands. I'm very excited. I cannot wait till next Wednesday. I'm really looking forward to this. I'm really not, I'm not apprehensive. I'm not looking forward to the day after surgery. I'm sure it won't be the highlight of my life, but I don't think it's going to be painful either. And I'm really not scared. I'm really excited about this. It's something I'm giving myself. Is a gift.
The goals of most facelifts are to improve the appearance of the jowls. Depending on facial anatomy, some techniques do this better than others. This is why the facelift technique should be adjusted to the individual patient. The deep plane technique is a very powerful method for correcting jowls. Jowls form when the retaining facial ligaments become lax with age. Her jowls are quite noticeable. They distort the appearance of the jawline, which changes the overall shape of her face, resulting in an aged appearance. The other goal of a facelift is to improve the appearance of the neck. This corrects the so-called turkey gobbler neck. Since we each age differently, this is not necessary in all patients. The technique is altered depending on the amount of neck laxity present. Another important area which contributes to a youthful appearance is the malar region. This is the cheek region. The deep plane facelift restores the position of the cheek fat pads into a more youthful location. Improvement in the mid-face region is a benefit of the deep plane technique over all other facelift methods. Starting as early as in our 30s, the cheek fat pad begin to fall. This leads to the formation of the nasolabial folds and, more importantly, an alteration in facial shape, which gives an aged appearance. So our goals for this procedure are to 1. Improve the appearance of her jawline by elevating the jowls. 2. Restore the neck to a more youthful appearance. And 3. Elevate the malar fat pad. Altogether, these changes will restore the face to a youthful shape and appearance.